Hello everybody, welcome back to Rationally Speaking with me and my co-host, Stuart Carrington. This is a podcast where we have conversations about rational emotive behaviour therapy, or REBT. I guess me and Stuart are interested in the world of performance, mainly sport, but we'll for sure get onto other bits and pieces. Hopefully you've listened to the conversations we've had currently. If not, by all means go back and listen to those. And today we're going to continue the conversation and go a little bit more in depth in one of the aspects of REBT.
Yeah, so hi everyone.
Hi, Stu.
So as you mentioned there, Martin, we're going to talk about like this framework in a bit more in depth. And for those people that have listened to the previous ones, we've sort of touched upon some aspects of the framework, and perhaps maybe not the most important, but a really significant part of that is the C, which stands for consequences. And those consequences can be emotional or they can be behavioural. And I think this kind of, the concept of dualism needs to be kind of just spoken about briefly here, because I think like an assumption of REBT would be that it kind of rejects dualism. So like the thoughts that we have will influence our actions, and we can't separate those. Would you agree with that, Martin?
Yeah, I think so. I think one of the dangers of putting up the framework that we did in our last conversation, a few conversations ago, this GABC framework, one of the dangers of that in how it's been presented is it's presented as a linear, kind of, it probably looks like a process. You go from G to A and A to B and B to C. So one of the things that we spoke about was how thoughts, emotions, behaviors interact with each other. And sometimes it's hard to separate them. And this is something that Albert Ellis knew really keenly, and he was very keen to impress upon people that sometimes it's very hard to distinguish between these things, and often they're obviously all happening at the same time. So when we come to the C part of this framework, the consequences, I suppose we should spend some time talking about emotions and behaviours and how we might distinguish between a consequence that is helpful or healthy and a consequence that is unhelpful and unhealthy.
For me, and I'm not sure about yourself, Martin, but that was something that was really attractive around REBT. I know previously we've spoken about maybe what's drawn us to this framework or this theory. And for me, it was this concept of we can have negative emotions, but some negative emotions, they're not only normal, i.e. we all experience them, but some of them can actually be kind of adaptive. They can help us. So perhaps like, to give an example of this, like we might feel concern about something. So we might, have an exam or some sort of test that we want to pass, like a driving test might be a good example. And so we have a concern that if we don't study the highway code, if we don't practice maneuvers in the car, then we're not going to pass it. And so that concern drives us to take action, i.e. like we might study, practice more, like talk to people about their experiences of something and to gain that vicarious experience or knowledge to pass the test. And so we might, I think nowadays we sort of, where there's so much focus on like well-being and the emotions that we might experience, any kind of negativity is something that is sort of to be eliminated. And Ellis was particularly clear that REBT doesn't seek to eliminate an emotion, it seeks to minimize or modify, might be a better word there, those emotions to shift from maladaptive to adaptive.
Yeah, I think it's this recognition that even though the emotion might feel unpleasant, it's not necessarily problematic for, say, performance or for the pursuit of your goals. The idea that you would have a goal and that you would pursue it without adversity, without barriers, is ridiculous, really. Yes, maybe if you're setting your bar really, really low, but if you, as we said before, if you set up any goal, then you invite adversity. And when you invite adversity, it's going to result in negative emotion. Now, that negative emotion is a signal. It's telling you that something is happening that is against what I want. It's against my goals. Doesn't necessarily mean that that's going to be a bad thing. That emotion is going to stop you from then going forward and achieving that goal. And on the contrary, there's obviously evidence that those negative emotions can actually aid in you attaining that goal. Stu, you gave an example there of anxiety versus concern is what we would say in RBT, which I've never really been keen on because concern to me is too cognitive.
Okay.
I like healthy, unhealthy, adaptive, maladaptive. So I'd say healthy anxiety and unhealthy anxiety. Now, in sports psychology literature, we have similar but different concepts. We have things like facilitative and debilitative anxiety. That's more about my perception of the anxiety symptoms, my perception of anxiety itself. We have things like, stress mindset, which is about my uh, my beliefs and thoughts about stress itself, which clearly is linked to REBT. But what we're talking about here really is healthy anxiety and unhealthy anxiety being different emotions with different behaviors associated with them and different cognitions as well. And that the route into those emotions at C is dependent on our beliefs at B, which we spent a lot of time talking about, irrational beliefs. So I've got a goal, I'm moving towards it, I face an adversity, and I approach that adversity or react to that adversity with an irrational belief. That's going to set forth unhealthy, negative emotions. Versus if I approach or react to that adversity rationally with rational beliefs, I'm going to have healthy, adaptive, helpful emotions and associated behaviors. That's where RBT starts to distinguish itself from lots of other theories and frameworks.
See, I think just before we go a little bit more in depth around emotions and particularly like the maladaptive emotions that REBT would seek to kind of modify, you mentioned language there, and language was really important to Ellis. So I know that one area that he sort of wrestled with quite a lot was this term like low frustration tolerance, for instance, because he felt that term might be a little bit dismissive of someone that's actually had quite a serious adverse event or negative life event. Now, I think he's settled on low frustration tolerance in the end because, for want of a better word, but I think that just goes to show the importance that Ellis placed on language. How important do you think kind of language is in certain environments that may promote certain beliefs, which in turn will promote emotions because B's and C's are linked, particularly in a performance environment, I guess.
The performance environment, yeah, well, it's fundamental, isn't it? And one of the things that we're trying to do when we're, I suppose, trying to create a psychologically informed environment or climate is to help people to understand the power of language. Not only, the language that you communicate to others and what you use, whether it's a dyad or whether it's a room full of people, what you use to describe situations and events that can influence people's reaction to those events. For example, if I'm a coach and I'm describing that performance as terrible and awful and the fact that I'm devastated at that performance, then I'm communicating something quite severe there that might not necessarily help the people around me to be able to cope with that loss or poor performance or whatever it is. But also language in. So what am I using internally to describe events to myself? So language is really, really key. For RBT, I don't know if you describe it, it's sort of a language-based idea, really. The subtleties in the differences between how you describe things. The idea that something is bad but not awful versus bad and awful. The subtle changes there in words that change the meaning quite severely.
I think there's a term that I've heard used before is kind of this lexiconic significance or cultural lexicon, if you like, where you said bad and awful. Like they do have subtle differences. They do mean different things, and it's why these words exist and this language exists. But actually, in certain environments, and from our background and interest of performance environments, often they're interchangeable. And I think that perhaps one reason for that might be like the culture and the socialization of those particular words. And maybe another one would be almost fear of how it may be perceived, so like the optics, if you like, of that. So, for instance, if an athlete was to say, it's not awful, I didn't want it, but it's not the end of the world. Maybe fans of that particular athlete or team might think, well, this guy doesn't care, and there's this kind of maybe this distinction also in RBT between acceptance and condoning. That they're very different things, they're very different concepts that lead to different emotions.
Yeah, and also you've got the difference between what people say and what people really believe. And in any publicly facing, context, like sport, then how seriously do we take rhetoric? You know, do we really believe that when an athlete says it's terrible and awful, and do they really mean that, or as you say, are they saying it for optics? Are they saying it in the moment? Is it a time limited irrationality, something they're verbalizing for a specific purpose, a specific reason? Or do they really deep down believe that that's the case? And that's one of the things that we've got to help people to distinguish when we're working with them. When you say something like terrible and awful and you know, it's the end of the world, is that something you truly believe, or is it something that it just passes through you? It's just a momentary thought or cognition. Is it something you're saying to elicit sympathy from the people around you? Because to me, obviously, you know, language is a complicated subject, but one of the reasons that people use certain words is to elicit certain responses from people around them. And if I use the language of irrationality, then what can happen is that I elicit some sort of sympathy from people around me, and I might be able to get attention. And the more that I do that, the more that I'm then likely to use those words, because it gets me the attention that I seek. Regardless of whether I truly believe those words, I'm using them as a tool to at least utilize the support that's potentially available to me. So there's lots of reasons why somebody might speak in irrational language. It could be a motivational purpose. It could be that the more severe my language is, the more likely I am to get you to do what I want you to do. So I can use it as a motivational tool for people around me, and as a motivational tool, you know, for myself. So we have to separate, particularly when we try and help people and work with people. We've got to separate serious, deep down irrationality that is based on these core beliefs that we carry around with us, that we take really seriously and believe, versus language that we're using for a specific purpose within specific contexts.
I completely agree. And I think some of the points that you mentioned there really emphasize a couple of things. And one of those things it really kind of strengthens is this interdependent relationship, okay, between like goals, adverse events, beliefs, and consequences. And what it does is it reflects Ellis's teleological viewpoint. So this is a term that I've come across recently, which I really enjoy learning about. So teleology, for those that may not have heard this term before, is where we look at that we're sort of less interested in the causes. In fact, not less interested, that's not accurate. We don't really believe in like kind of cause and effect. We believe in like the here and now. And so what you're experiencing now and the emotions that you're experiencing now is all goal oriented. So you kind of hit the nail on the head with your example of, oh, okay, I might act in a way that's I'm really depressed, I'm self-depreciating a lot, or experiencing lots of anger because I want a certain goal. And that goal might be I want to elicit sympathy, or I want people to respond to me, or to tell me something positive about something that I've done. So it's all goal oriented. So those consequences are directly linked to our goals. And I think just in light of the conversation we were having previously, Martin, about kind of citing people, that's very Alfred Adler's work in the 20s and 30s. So it's Adlerian. So I think that we can talk about Ellis a lot, but you know, Ellis had this influence from Adler as well, around this kind of relationship between like goals and emotions. So I think that interdependent relationship is strengthened with that example and this teleological viewpoint.
Yeah, well, I think the emotion science literature also tells us the importance of goals too. It's within a lot of those definitions of emotion. The idea is that you're in pursuit of something, and that when you feel like you're progressing towards that thing, then you get to experience some positive affect or emotion. And when things aren't going well, then you experience negative affect, negative emotion. So the goals idea there for me is really, really fundamental when we're looking at C. As you said before, these are all interrelated. You can't just have an isolated emotion. You know, when we look at the affect generally, yes, we have mood in there as well, and sometimes we do experience moods, and there isn't a trigger point, there isn't a stimulus. Whereas emotion is something that's considered to be a response to a stimulus. So it brings into focus G and A quite nicely. So it's very difficult to imagine emotion without some sort of goal, without some sort of relevance to me. Why would I be emoting? It's not happening in a vacuum. And that also helps us to work backwards when somebody comes to us with an emotional difficulty. It might be, I'm highly anxious for performance, or during my performances, I'm becoming angry, and then I'm losing my temper, and then I get yellow card, red card, whatever it is. They will often come to us with an emotional issue. And then you've got to kind of work backwards, really. You've got to first figure out, is this emotion that is something unhealthy, unhelpful, or is it an emotion that is just unpleasant, but is actually helping the individual within that performance environment, or whatever context they're in, their relationship, their work? Is it helpful or unhelpful? That's your first job. And then you're trying to work backwards, really. You're trying to understand, well, what were the adversities that the person was facing? What are the goals that these situations are adverse to? And then within REBT, we're then trying to figure out, are there any underlying irrational ideas, philosophies, beliefs that are then taking those inconvenient, annoying circumstances and turning them into terrible catastrophes and intolerable circumstances. So the emotion is really a key piece of data for us when we're trying to work with people to work back from, because we're trying to make some theoretical assumptions there that if the emotion is being experienced here, then there's a GAB interaction taking place to give us that emotion. So we start to work backwards.
And if we focus on this emotion, then now you're like this, the key sort of terms we're really using here is this adaptive or maladaptive. So from an REBT perspective, like something that we would certainly be keen to sort of ascertain is this emotion helping you? Like, do the behaviours that these emotions kind of promote, like, are they helpful or are they unhelpful for what you want to achieve? And I think maybe to give the listeners a little bit of evidence that elite performers, so people in performance environments, tend not to necessarily believe what they say all the time. Right? We might hear athletes say things like, it's a must-win game, or it'd be the end of the world, or something like that. But in a study that we did, Martin, in 2019, one of the sort of key significant differences was that elite athletes experience much less self-depreciation. So just because they fail at something, it means they are less likely to believe they are a failure because it didn't go well for them that day. It's almost as if, well, failure is kind of like par for the course. I can't be a professional footballer, rugby player, or athlete and not experience failure. And so I can't possibly be a failure. Why would I identify, losing that one particular game or one particular final as defining my career and me? And so, they resist that urge to self-depreciate. So it was unwanted. It was disappointing, but it doesn't define me as a person. And then in turn, that cognition will promote more helpful or adaptive behaviors, so healthy anxiety, if you like, or healthy sadness. So sadness that might promote actions that make us more likely to achieve our goals.
Well, there's that piece of data that you're talking about there. There's potentially two things happening there, maybe more than two things, but there's at least two potential possibilities. One is that at the elite level, one of the things that it might take to get to that elite level is some level of unconditional self-acceptance that I'm not perfect and that sometimes I'll fail, but it doesn't mean I'm a complete failure. The humility of knowing that if I succeed, I'm not a complete success. So basically anti-global evaluation, not assuming that I can define myself wholly on some behavior that I did, whether it was, successful or unsuccessful. That's one hypothesis, that belief in itself is part of the mixture that makes an elite athlete. The other hypothesis, which I think is more likely, is that just the experience of sport itself helps them to self-dispute. So I know it can't be the case that failure is fatal, or that when I fail, I'm a complete failure, because I've succeeded and failed so many times. I've iterated that behavior so many times that it doesn't make sense for me to make totalistic claims.
Yeah.
So they develop nuance, and they self-dispute these beliefs that, of course, it's not the end of the world when I fail, because I've failed many times and the world's never ended.
Yeah.
Or I've experienced much worse things than missing a penalty in this situation, or getting sent off in that situation. It's just having more experiences and experiencing more A's, experiencing more adversities. It's almost self-disputational through experience. Now, that's clearly something that can only happen over the course of time. And obviously the work we're trying to do with REBT is fast forward people's disputational skills so that from a young age they can already understand that failure isn't fatal, and when you fail it is tolerable, it's not the end of the world, you know. But I think that's kind of an interesting thing that we kind of see probably the very experienced end. They've developed self-disputational skills through experiences, you know. Not everybody, not all of them, but probably a large proportion of the people that I've interacted with have had that capacity.
Yeah, we certainly see that like age is a factor here, you know, so the older the person, we tend to see that negative correlation with irrational beliefs. But in our study, you know, we actually found that it was more to do with like kind of sporting experience. So sport might be, or performance environments might be kind of a nice training ground maybe for adverse events, because you are going to, you know, have bad games, you are going to lose or have negative experiences. And so they're kind of ways, particularly in a society where we try to protect people and try to regulate the amount of negativity that goes on. These are kind of opportunities for people to experience negative life events, but in a way that are kind of tolerable. So, you know, losing a game might feel really bad. However, you know, we will get over it. So then, like you mentioned, you can self-dispute, and whether that's conscious or unconscious, I guess what we're trying to do is make that a conscious process and say, and challenge and dispute, and disputation obviously being a key part of the next framework, which we'll talk about another time.
That's right, and I think just on that point of why sport can be so powerful for that, something I've spoken about many times. You're iterating success and failure at a higher rate when you're engaged in sport than maybe you would do in other contexts. It's part and parcel of the sport endeavour. Is I tried something, it didn't work out, or I tried something and it did work out. You know, obviously success and failure is definitional. So it depends on your definition of success and failure. But it doesn't matter what your definition is. Within sport, you will try things and it won't work. You take that feedback, and if in response to those failures your world crashes around you, and you're going to struggle to really kick on and move on in sport in a healthy way. So because it iterates success and failure, it means there's lots of opportunities there to help athletes to orient themselves appropriately to success and failure. You know, how do you approach these things? How do you stay humble, understand that success doesn't make you a genius or a hero, and at the same time failure doesn't make you a complete idiot and completely useless. It's teaching nuance with athletes highly experienced who understand that probably subconsciously. When you work with them and make that bit conscious, it's often surprising that they weren't aware that that's what they were doing, but they can articulate it when you form a conversation with them, and they say, actually, yeah, that's what I do. I'm always surprised when I start working with people who already have these philosophies, but have never come across REBT, or have maybe even never worked with a sports psychologist. It's something they've realised and has helped them to pursue that career.
Martin, we seem to be back on G again, because you mentioned there about like definitions of success. So that again kind of goes back to our goal. So if our goal is to win X or achieve this title, whatever it may be, then we're defining success in that way. And like in your book, for the hip hop fans amongst the listeners, you know, Martin calls this nothing but a G thing. Well, actually, it's G Thang, isn't it?
Can I? Yeah, I was gonna correct you there. It's G Thang.
G Thang. Yeah, we want to be like specific.
Yeah, get it
right. So yeah, nothing but a G Thang. So like, goals are particularly important, like, and how we define success or failures. And so, I guess my point here would be, when we're from an REBT perspective, should we be looking at disputing maladaptive emotions, i.e. sort of challenging, you know, helping people to self-dispute and to challenge like these thoughts they have, i.e. it's not the end of the world, it's certainly not welcome or not pleasant, but you'll cope, you'll be okay? Or do we challenge goals, or do we do both?